Meeting of this session, and we do have one or two new members. I've asked the clerk to take a roll.
Senator Coyne. Here. Senator Crowley. Here. Senator Golden.
Here.
Senator Miller.
Here.
Senator Nesselbush.
Here.
Senator Ardiano. Here. Senator Satchel.
Here.
Senator Sheehan.
Here.
Senator Sosnowski. Here.
All members are present. We are here today for the advice and consent of Governor Charles J. Fogarty to the Director of the Division of Elderly Affairs. Do we want to start with the witnesses or Mr. Fogarty? Okay. Let's hear from the witnesses. We have Maureen McGregor. Margaret. Too late now.
Good afternoon, Chairman Miller, honorable members of the Senate Health and Human Services Committee. I'm really delighted to be here this afternoon to testify in support of your recommendation for advice and consent of the Honorable Charles Fogarty for the position of Director of the Division of Elderly Affairs. Let me just briefly tell you my background and why I'm so delighted to be a witness for Charlie. I'm a former member of the General Assembly for 10 years. I served as Director of the Department of Elderly Affairs under the Honorable Governor Bruce Sunland, and I worked with Charlie Fogarty for some 10 years, 2 years when he was President of the Senate, and 8 years as Policy Director when he served as Lieutenant Governor. So I've known Charlie for about a dozen years, and I know him to be a competent and experienced manager, a strong and a bold advocate for good public policy, someone who works very well with others to seek solutions and get results, someone who is not afraid to seek change when change is needed. You know, we used to laugh in our office, Charlie and I, we'd say, you know that old definition about what's a bureaucrat? The answer is someone who will give you a dozen reasons why you cannot do something. Charlie does not fit that mold. He is not afraid to make things happen. So let me make the case for this particular appointment for Charlie. As a Lieutenant Governor and as a member of the Senate, Charlie was a leader in health care reform and in aging policy and long-term care. Way back in 1998, he sponsored and won passage in just 1 year of the state's health care quality reporting law, a law that called for reports on both clinical quality and consumer satisfaction across the spectrum of health care. In fact, that law served as a model for the National Centers for Medicare and Medicaid when they started their quality reporting programs. He was able to get that law passed because he was such a good consensus builder, bringing together the key stakeholders, hospital executives, people from nursing homes, people from the physician community, to reach consensus on a bill and get it passed. During those years, he worked continuously prior to the Medicare Part D prescription drug program. He worked continuously on almost an annual basis to expand the state's pharmaceutical assistance program for the elderly, helping thousands of our state elderly afford their prescription medications. He championed states' efforts to balance long-term care spending to increase the dollars spent on home and community care. He fought on many occasions, I recall, to save what we call the state copay program that helps frail elders stay in their home by providing subsidies. They pay a portion, the state pays a portion for adult daycare and home care. And on a number of occasions when the Budget Office recommended slashing that program, he successfully fought to maintain it. I could go on about Charlie's very extensive list of accomplishments, the fact that he worked to create a volunteer guardianship program for our frail elders who have no one to speak for them, that he provided and fought for appropriations to provide respite services for family caregivers, that he worked to increase the pay of our direct long-term care workers, but I trust that I have made the case for why I think he is an excellent choice for this position. The number of older persons in Rhode Island is projected to increase by about 40,000 in just 5 years by 2020. And the first of the baby boomers will reach their mid-70s in about a decade. It is crucial for the state to pay attention to this demographic, to enhance the network of services that help elders stay healthy and to age in community, and to support the many, many family caregivers who provide them with assistance. That is the job of the Director for Elderly Affairs. I think Charlie is up to that challenge, and I would say it's ingrained in him through the legacy created by former Congressman and his uncle John Fogarty, who was responsible at the national level for things like helping to get Medicare passed, the Administration on Aging passed and funded, and so many services for persons with disability. I'd be happy to answer any questions, but again, I appreciate your allowing me to be here to be a witness for his advice and consent. Thank you. Any questions?
Any questions? Thank you. Mr. Fogarty?
Mr. Chairman, members of the committee, thank you for this opportunity to appear before you regarding my nomination by Governor Raimondo to be the position of Director of Elderly Affairs. I'm excited about the opportunity to join the governor's team and to work on her agenda to improve the quality of life for older Rhode Islanders. And I also want to take this opportunity to thank my friend and colleague, Maureen McGregor, for her very kind words. She is one of the most talented, energetic, and change agent people in government that I've ever had the pleasure to work with. And all of the things she talked about that we were able to accomplish in my term as Lieutenant Governor, I think a lot of those owe to Maureen's hard work, innovation, ideas, and a willingness to look at things in a different way. So I just want to thank her for her friendship and her advocacy even today on the senior agenda. As you heard from Maureen, and as you know, my interest in services to older Rhode Islanders is a long-standing one. For 10 years, I chaired the Rhode Island Long-Term Care Coordinating Council, both as state senator and as lieutenant governor, which coordinated the policies and developed programs and advocated for legislation to help older and disabled Rhode Islanders. I sponsored numerous pieces of legislation that became law, which helped improve the quality of life for our seniors, including, as was mentioned, significant expansion of our RIPAY program, nursing home reform and oversight, expansion of assisted living opportunities for low-income seniors, new requirements for Alzheimer's unit, and support for adult day service and respite care, among others. And working with my colleagues in the General Assembly, as well as many senior advocacy groups, I also helped lead the effort that resulted in a significant increase in the budget allocated for home and community-based care services, such as Meals on Wheels, both in actual dollars and also as a total percent of the long-term care budget during my 2 terms as Lieutenant Governor. I chaired the committee which looked into the tragic death due to neglect of Jermaine Morsilli in the Hillside Nursing Home in Providence. And a result of our efforts, the Jermaine Morsilli Act became law and put into place additional safeguards for our seniors and their families, as well as greater oversight of facilities to ensure such a tragedy would never happen again. So as you can see, for me, the position of Director of DEA is not just another job or the opportunity to work on a very important policy area of government, but the chance to continue with a mission and a commitment I feel very passionately about, helping all our seniors maintain a high quality of life, no matter what their age or limitations. Governor Raimondo has stated on many occasions that services to seniors are an important priority for her administration. And during our discussions before my appointment, she made very clear to me that she expected DEA to be a strong advocate for all our seniors and their families, and to work to provide support services necessary to keep seniors as independent as possible and in the community for as long as they are able, to really develop a continuum of services that meet the appropriate needs of each individual senior. In a public forum this past summer at the senior agenda during the campaign, the governor made this statement: Finding ways to keep the elderly living at home and involved in the community is not only more healthy for them, but serves as a smart investment since it saves health care costs in the long run. And for the governor, too, this is a personal matter. She's often told the story as a young girl of the love and support her aging grandfather received after her parents moved him into their home when her grandmother died. She saw firsthand how much better it was for her grandfather, as well as how much her grandfather enriched their family life when he lived with them. So if I'm confirmed as director, I look forward to working with you on the governor's priorities and on the agenda this assembly establishes as well to provide for that continuum of care for our seniors. First, supporting services and programs that allow older Rhode Islanders to maintain their independence and stay in their home in the community. Second, to ensure that fragile and vulnerable seniors receive appropriate care and protection when they're no able longer to care for themselves. Third, to work to engage the younger generation of seniors to contribute their talents and experiences to improving our state's economy and quality of life. And finally, to work across department and agency lines to ensure a coordination of service that provides a simple and seamless system for our clients while being affordable to our taxpayers. And that will work very closely with Melba DePina, the Director of Human Services, of which DEA is a division, as well as former Lieutenant Governor Roberts, who is Executive Secretary of the Office of Health and Human Services. Mr. Chairman and members of the committee, the Raimondo administration wants to make Rhode Island a national leader for caring, innovative, and effective services for older Rhode Islanders that will allow them to maintain a high quality of life, no matter what their age or limitation. Our most important measure of success in meeting this goal will be ongoing improvements in the quality of life for this important and growing segment of our citizenry. And with that, Mr. Chairman, I'll be happy to try to answer any questions the committee may have.
Any questions?
Just comment, but I'll defer to the chair.
Okay, sure. Okay. Senator Sheehan.
I just wanted to thank you for coming in, of course, for this nomination process, and just say that I have worked with very few very talented people, consensus builders like yourself. You had that privilege, and I think you're a tremendous asset to the people of Rhode Island. I am very happy to say that the governor has found a place for you in her administration to continue the good work that you do on behalf of the public, and I look forward to supporting this nomination. Thank you.
Thank you, Senator Sheehan. I think, as I mentioned before, I think all the gray hair I earned as director of DLT over the past 4 years made me a very logical candidate for director of DEA in the Raimondo administration. So
Experience counts.
it does.
As Maureen McGregor pointed out, the population of elderly in Rhode Island will increase by 40,000 in the next 5 years. What kind of priorities do you see that creating for the department?
I think there's also not only priorities but opportunities, Senator. And certainly, I think as a state, I think you would agree that our top priority is those frail and vulnerable seniors. While all of us are getting older, the percentage of the population is increasing. The numbers themselves are increasing, the gross numbers. The fact is that newer seniors tend to be healthier. But there's always going to be those that need particular care and support, and we need to make sure that quality, affordable care is there for them and their loved ones. We also need to focus on that next group, kind of that continuum, those who might just need a little bit of help to stay in the community, whether it's meals or support services or the companion program, something that just allows them to stay active and in the community. We want to keep people engaged. We don't want them separated and apart. I think, thirdly, what I see as one of the big opportunities coming down the line, quite frankly, is what I call the young seniors, those people, the early baby boomers who are moving in there, whose health is good, who have a desire and a talent to remain active and involved, and who may want to start second careers, businesses, who may want to be involved in other things, contributing to help develop Rhode Island's economy and our quality of life. And how do we reach out and engage those people? I think that's going to be an interesting opportunity in the next number of years as well. So how do we make all of those things work together so that regardless of someone's age or any limitations they have, they're able to live a life to the fullest extent possible? I mean, that's our goal.
I think hearing from constituents, there are two issues that come to mind as priorities that I've heard from constituents. One of them is the transition either from having home-supported care to assisted living and then to more specialized, whether it be nursing or other specialized care. And the other is a more specific issue that I think has probably not a real number to it, but more a process that needs to be repaired, is get many constituent calls on transportation issues, whether it's RIPTA or otherwise, and it seems to be a logistical issue rather than an expense issue that maybe could be given some attention.
Thank you, Mr. Chairman. As a matter of fact, Secretary Roberts, who has kind of her own cabinet meetings on Fridays, we had our first one last Friday, talked about the transportation issue across all fields of her, as the need to kind of do a better job, coordinate it for those folks who are there. One of the things I'd like to bring up that addresses, I think, the first point that you made that Senate President Paiva-Weed mentioned to me as well in our meeting prior to this, was the fact that while we want to keep people as independent as possible, we also have to kind of look out for them. And family networks and supports are great, but the way the world is today, with people living all around the country, that's not always present. So we have to understand that and make sure that even if people want to stay home, if there are some needs there that the family may not be aware of, that we're ready to make sure that those services are available to them, to move them to whatever level is appropriate. That's going to be a challenge as well. We have smaller families, we have people living all around the country, and in a sense, that responsibility kind of falls to us, and we're going to have to keep an eye on that.
Senator Crowley?
First of all, I'd like to say that I've known Mr. Foley for several years. There couldn't be anyone more appropriate for the position than you are. You get my 100% support on this position. The one question and the one thing that I feel for the community has a large elderly population. The one thing that concerns me about our elderly is when they're going to a nursing home and they have to go to the hospital to lose their bed. And it's like being in a home all over again. Bad enough that you have to make the transition from the home to the nursing home, and now you're in the nursing home, you're specifically home, and you have to go to the hospital the bed is in because they say they're working twice or something. I have a lot of seniors that say they have difficulty with that because they feel that their check is given at the beginning of the month, or the 15th of the month they go to the hospital. If they focus on that kind of issue for our seniors, I think it would help them.
Senator, I'm kind of getting, while I have that experience, I've been focused on other issues for the past number of years, but as I recall, and I'll have to check on that, at one point there was a program where people were allowed to maintain a bed, and I don't know if they had to pay for it, but yeah.
At the expense of $300.
Okay. But you're absolutely right, though. That's someone's home, and it's like any of us. I mean, none of us would want to have to move our homes. It's very disorienting, particularly as people get older and more fragile, and it affects their health. So the point is well taken, absolutely.
Senator Golden?
Thank you. Thank you so much for coming today, and I appreciate the opportunity to talk with you about your vision for elderly affairs. I've had the pleasure of working with you, particularly this past year, as DLT implemented temporary caregiver insurance, and it has been wonderful to see the impact that has had in the state. As you know, the data, I just saw the numbers today, that just under 4,000 families were able to use it this past year in order to take time off to care for somebody, and in many cases that has meant caring for an elderly family member who is either going through a significant health crisis, or, as many of my constituents have talked about, their families with Alzheimer's and taking care of a parent with Alzheimer's or a spouse. One of those things that we have talked about and struggled with really trying to figure out is how do you do outreach? So I'm wondering, as you take that knowledge of the experience of getting temporary caregiver insurance off the ground at DLT, how can your new role in elderly affairs make sure that we're doing the right amount of outreach to families that need to care for elderly?
First, thanks for your leadership on that issue. I know President Obama was following your lead with his proposal tonight, and Senator, on that. But thanks to your support in the Assembly, we were able to get that program off the ground and get it off successfully. But you're right, there still needs to be an outreach. I know the department itself has an outreach to individual employers and employees, but I think one of the things we can help with is through our own system of referrals. is to let our constituencies know, whether it's the seniors themselves or their family members, that this is available to somebody if they need it, so that they have that kind of safety net available. And we certainly will work to get that information as part of our overall information referral that we provide to all the folks who do use us for that purpose.
Any other questions? Senator Adiano? Yep.
I think your resume, anyone who's watching these hearings and might know you or look at your resume, all we're really doing is sort of giving you officially the job that you've done in many capacities for several years, not the least of which, again, in the resume, you work on the long-term care coordinating council, work on National Legislative Commission on Prescription Drugs. You've been working for the elderly in Rhode Island for a long time, and now to make it official, I share from the other side of the aisle full support of Senator Sheehan. Thank you, Senator.
Any other questions? If not, at this point, I would like to propose the granting of advice and consent, Charles M. Fogarty, to the Director of Division of Elderly Affairs. We'll have the clerk take a roll of the vote.
Second.
All those in favor? Senate President?
Senator Algier.
Yes.
Senator Ruggiero.
Yes.
Senator Lee.
Yes.
Senator Coyne.
Yes.
Senator Crowley.
Yes.
Senator Golden.
Yes.
Senator Miller.
Yes.
Senator Nesselbush. Senator Ariano.
Yes.
Senator Satchel.
Yes.
Senator Sheehan.
Yes.
Senator Sosnowski.
If I've counted correctly, your advice and consent is unanimous. Congratulations.
Thank you, Mr. Chairman, members of the committee. Thank you.
Will we adjourn?
Adjourn? Motion to adjourn?
I heard a second.